Hello, everyone. Welcome to Toolkit Talks, Joy in Work, Video 1. My name is Jennifer Smith, and I'm an outreach professional here with CoCares, which is the Colorado Alliance for Resilient and Equitable Systems, serving the healthcare and public health workforce, and we are under CDPHE. The Joy in Work Toolkit was created by the National Association of County and City Health Officials using the Institute for Healthcare Improvements framework for improving joy in work. And we are not the creators of this toolkit, but they are. And so we're just using their information from the toolkit because we think it's a really great one. And it's really important, has some great information in it. And we just want to present it to you in a really understandable, easy, accessible way. And if you haven't already, I would definitely go check out NACCHO's website as well as the Institute for Healthcare Improvement. I'd say the Institute for Healthcare Improvement definitely has more information on the framework and joy in work. Tons of information on there, lots of videos, lots of detailed information. So check that out before you kind of dive in to these videos and to the toolkit. The reason we're doing this really is our objectives are just to showcase and bring them to awareness for you guys, because it's just really hard to look up information. It takes a lot of time, and then finding the best resources for you. So we're bringing things to you, hopefully in a really easy way. And we hope change leaders and managers and teams and things can bring this information either to their organization and implement, or maybe to those managers and leaders that can implement the change and create the joy in work. And then we're just trying to take deep dives into these toolkits. We are not the creators of the toolkits, but we are just trying to bring their information to maybe a different audience. And then what to expect. So this is the first video. There's a total of 6 of them. The first 2 are really going to be kind of preparing you to dive into the toolkit and giving you the tools necessary that you'll need for that. And then we will have live versions, but if you've missed those, we will be posting everything here on YouTube, so you'll have the entire series available to you. And again, this video is really an introduction, purpose, principles, and then giving you some pre-work before you jump into the toolkit. So we're going to go ahead and get into the information. This right here, these are the IHI's Joy in Work steps, and they build on each other. So there's 4 steps total. The first one is to ask staff what matters to you and start the conversation. 2 is identifying unique impediments or barriers to joy in work in the local context. And then 3 is committing to a systems approach by making joy in work a shared responsibility at all levels of the organization. And then 4 is to use improvement science to test approaches to improving joy in work in your organization. So today, again, there's 2 videos previous to the first step. Today is really just a preparation stage and making sure that you understand kind of the context and the things that you need to know before getting started. This is the framework. So this is the framework from IHI and how they kind of came up with their specific framework for improving joy in work. So you can see, we'll just kind of go around from left to right. So there's real-time measurement, which is, contributing to regular feedback, radical candor in assessments, and doing all those testing approaches that you need to do to make sure your changes are actually doing what they need to do and bringing joy in work. Then you have wellness and resilience. So this is the health and wellness, self-care, cultivating resilience, stress management, role modeling values, system appreciation for the whole person and family. It includes work-life balance and mental health, such as depression and anxiety support. Then you have daily improvement, which is employing knowledge of improvement science and critical eye to recognize opportunities to improve, and regular proactive learning from defects and also successes. Camaraderie and teamwork, commensality, which is eating together, social cohesion, you have productive teams, shared understanding, and trusting relationships. Then participative management is co-production of joy. Leaders create the space to hear, listen, and involve before acting. There's clear communication and consensus building as part of decision making. Recognition and awards or rewards. Leaders understand daily work, recognizing what team members are doing and celebrating outcomes. Choice and autonomy. Environment supports choice and flexibility in work, hours, and use of electronic health records. Meaning and purpose. Daily work is connected to what called individuals to practice, line of sight to organization mission and goals, and constancy of purpose. Physical and psychological safety. It's an equitable environment, free from harm. There's a just culture that is safe and respectful, and support for the second victim. So you can see that those are around where it says happy, healthy, productive people. All of those pieces of the pie need to be there. And then you can see on the outside, so we have senior leaders are on the outside of the circle. Then you have below them, it's managers and core leaders go around, and then it's individuals. And so senior leaders really are responsible for all of those. And then managers and core leaders are responsible for real-time measurement, wellness and resilience, daily improvement, camaraderie and teamwork, and participative management. And then individuals are responsible for 3 of the pies, which is real-time measurement, wellness and resilience, and daily improvement. So that's how they've kind of worked out their framework to be a team effort. But, you can see, of course, the higher you are as a leader, then the more responsibility you have to bring happy, healthy, productive people to your workplace. So the Joy in Work Toolkit purpose. So really their purpose is to increase joy in work. Senior and core leaders engage in effective, meaningful conversations with colleagues to understand what matters to you in daily work, how to build on assets, what helps make a good day, when we are at our best, what does that look like, and what gets in the way of a good day. And the principles of the Joy in Work Toolkit are ask the question, listen to the first response, then allow for deeper reflection about initial comments. Be comfortable with silence. Practice curiosity and inquiry to listen, not just to hear, but also to understand. You do not have to fix everything now. The intention of the conversation is listening to understand what matters, then working together using improvement science tools to address the things that get in the way of what matters. Ensure that this work is done with colleagues and team members, not to or for them. So as you're getting ready and preparing for the What Matters to You conversation, you really should make sure that you have your listening skills, your communication skills up to par. So I would just make sure that you are just reviewing your skills and really just making sure that you can have these conversations and that you understand kind of what it means to have these conversations and really listen to people. And the first thing would be to talk about active listening. Active listening is important to have more meaningful conversations. People want to be heard. For most people, that doesn't happen at work often. Active listening to the speaker, you are concerned, helps obtain better information, encourages further communication, has the potential to enhance relationships and create rapport, can calm someone who is upset, invites others to listen. It encourages better cooperation and problem solving. So these are very important parts of active listening that we should all be aware of before kind of going into any conversation that could be really important. So this is an important step, and you want to just make sure your conversation, your communication, your listening skills are ready. And then active listening, again, is paying attention. It's avoiding interruption. It's withholding judgment, approaching with curiosity, paraphrasing and summarizing, modeling positive nonverbal behavior, and asking specific open-ended questions. So making sure you are really just paying attention and understanding what they're saying. The open-ended questions can be things like, tell me more about that. Why did you feel that way? Why did you do that? Just understanding fully and then asking, this is what I hear you saying. Is that correct? So you really want to ask the questions that lend to a sense that we are in this together. Understanding, communicating, and listening is essential. For further information, you can go to asana.com or find other resources you may find online on active listening. That's just where we got our information, but there's plenty more all over the internet that you can look for. But just make sure you're just making sure that they understand that we are in this together and we're doing this as a team. So hearing versus listening, we have this information. We found a great course on cotrain.org from FEMA. You can see the course ID there and the information on it if you would like to check that out. Cotrain.org is just a great tool to find any kind of trainings. It doesn't necessarily have to be for work. It can be for personal, but there are some good trainings on there and you just have to sign up with an email. But it says that hearing is a sensory experience that gathers sound waves indiscriminately. We hear something without choosing to listen. And listening is the ability to accurately receive and interpret information, messages in the communication process. So, right, hearing is kind of the sense that we have, we can hear, but listening is really kind of gaining knowledge and gaining information from what the person is saying. And the course covers listening, nonverbal communication, using your voice and engaging the audience. They have some good Brene Brown videos on there as well. So it's a good course if you want to take that to just make sure that you're understanding what really communication is and what you're going to need for this process. And so that's it for the first video today. I really appreciate you coming to and watching this video. Again, this is just the first part of it. It's really just preparing you for having conversations and getting more information on communication and active listening and all that. If you need to contact us, please email us at cdphe_healthcareworkersupport@state.co.us. The phone number is probably not going to be in service at this time. And then our website, of course, is co-care.org is actually our website. So it's co-care.org. And we really appreciate you coming to watch our video. Please stay tuned for the second video. And then as we record our monthly webinars, we will be putting more up on our YouTube channel, and you can watch those in the order that they come out. So we appreciate your listening. Thank you so much.